Welcome to the Ziria Family Show. Hi everyone, hope you are okay. Okay, today is going to be very interesting and exciting. So I just want you to stay glued to your screen. Don't just leave there. So this past few days, the thought of this particular program came to my mind. I was pondering on the words, the reality of ADHD. So many things came to my mind. What families are going through because of this. Some of them, they don't know how to manage it. So that's why we are here today to discuss about it. So today, I'm not just going to be doing it alone. I have my beautiful sis in the house that's going to be helping us to treat it to the simplest form, to the simplest forms for easy understanding. Okay, she's no other person than Mrs. Gloria Ogbe.
Yes.
So, Mrs. Gloria, can you please introduce yourself?
Good afternoon, everyone.
Yes,
This is Ogbe Gloria, a special educator, certified special educator. Um, we're here to bring to you the reality of ADHD. I pray that even as you learn from it, you'll be able to apply it to your daily life. The grace of God.
okay, thank you very much. So, we are just going to kickstart
Okay.
immediately. So, I'll just be going straight to all the questions I have for her today. So, the first question I'm going to be asking her is, what's the meaning of ADHD? What's the meaning of it?
Okay. ADHD. This is an acronym for the word ADHD. Hyperact. Sorry. What?
Question?
Attention deficit and hyperactivity disorder. Okay, this is a neurological disorder. It has to do with children who are hyperactive, who maybe they are not able to pay attention to things. Do you understand?
Okay.
Who find it difficult to sit in a particular place and to actually do what they have to do. And this as a result of not paying attention to what they ought to do.
Okay. Thank you very much. Um, do you have like any example you can give us so to make it in a simpler way for people to understand? Like example.
Okay. An example of a child with ADHD. Actually, ADHD is not just for a child. It's
Okay,
not,
okay.
yes, it's not
Is
just
it
a
possible? It's
child
possible
thing.
that there are
An
adults who
adult
also
can also
exhibit
have
it. Okay.
ADHD. So, in situations where you have a child misbehave, let's say you see a child jumping or restless, you know that there is something about this child. Do you understand? Now there are disabilities. These are disabilities that needs to be attended to. You need to know that okay, this is not a normal behavior. It's a
Behavior.
neurological behavior and it has to be attended to.
Okay. So what are the causes of it? What are the causes of ADHD?
Okay, I'm going to break it into three aspects.
Okay.
You know, the prenatal stage, the perinatal stage, and the postnatal stage. Now, a child can acquire ADHD from the prenatal stage. Let's start with the prenatal stage.
Okay.
Prenatal stage has to do with before birth.
Okay.
Now, before birth, a mother takes in, right? She conceives, and then a mother who smokes has a high tendency of bringing out a child with special needs. You
Hmm.
understand? It's a mother who is an alcoholic. Yes, can also. Then another thing is the wrong use of drug. There are some
Okay.
kind of drugs you use. Some people don't even know they
That
are
is not
pregnant.
prescribed.
Yes, both unprescribed drugs, even are drugs, any kind of drugs that
Okay.
is not meant to be taken. Do you understand? Like for instance, a mother that who does not even know she's pregnant and is
Okay.
taking some kind of drug that could
Okay.
affect
Thanks.
the child that she is. Another thing is abortion, trying to abort the child. There's some children upon trying to abort those kids, they you tend to damage
Big
some
sun
parts of
part.
the brain. You
Wow.
understand? And
Wow.
then instead of losing the baby, you bring out the baby, and the baby becomes a what? A special child. You understand? Then another thing is accidents. A pregnant woman in the process of maybe washing could have a very
The
serious
fall.
fall.
Okay.
Yes. Now the that process could lead to a damage in the child's brain. You understand? Now, when the child is born, you discover that okay, this child has been born. Eventually, the child start growing, you start seeing all these behaviors in them. You get it? Now,
Okay.
I've talked about wrong use of drugs.
Drugs.
I've
Okay.
talked about alcoholism, smoking. I've also talked about fall, right? Okay, now let's move to the perinatal stage. Now, there's a period where the mother is about to give birth. The major cause of ADHD in children with special needs comes during birth. And this could be as a cause of wrong use of forceps. Is what we call forceps. Forceps are the instruments that the doctors use
Use.
for to perform surgical operation. You
Okay.
understand? So wrong use of forceps in the sense that trying to bring out the baby from the womb, and then the baby sustains injury.
Injury.
Yes, during the process. Yes,
Wow.
that could lead to a child having
Having special
special
needs.
needs. Do you get it? Then wrong use of um, forceps. The other one is another thing regarding that wrong use of forceps. Maybe the forceps are not sterilized. It could lead to the child having some kind of infections. Do you get it?
Hmm.
So, and these things actually lead to a child having special needs. I'm in the perinatal stage, right?
Yeah.
Okay. Another thing about this perinatal stage is um, lack of blood.
Okay.
Yes, when the mother is having shortage of
Then
blood in
shortage
the
of
body,
blood.
so the fact that they start looking for one or two ways to get her to be okay, it can cause it. Okay, let's move to the postnatal stage. I'm talking about the causes of
So
ADHD.
ADHD.
What
Yeah.
can actually lead to a child having
Having
ADHD or special needs in general? Okay, when you talk of the postnatal stage, now the baby has been born. Okay, not forgetting that something could have happened before birth, something
when
could
we
have
are
happened
having the
during
during
birth,
birth.
and now we are in the after birth. Now the child has been born. You refuse to give this child the right immunization.
Mm.
This could lead to the child having either measles. That's why you see these people going out.
House to house.
Yes, to have immunization for their kids. The first immunization is very important for the child so that the child does not, get some kind of infections. That's why you see some mothers when they give birth, they try to make people stay away from the child until
Oh
the child
yeah,
gets
yeah,
their BCG.
yeah,
You
yeah.
understand? Okay, so wrong use of sorry, the what am I saying?
The immunization.
Immunization. Okay, now not taking immunization can lead to a child
The
having ADHD.
ADHD.
Another thing is accident. Accidents can make a child have disability in the sense that okay, I am breastfeeding my child, for instance, and then I lay the child on the bed. Then, upon breastfeeding that child, I slept off. The child could fall. When the child has a fall, there is a damage
Tendency.
that fall
Yeah.
can cause on the child.
Hmm.
Do you understand? And this can lead to serious damage. It might not necessarily lead to only ADHD. It could lead to some other factors. It could be deafness.
Hmm.
You understand? Yes, it could also be autism. It could be whatever it is. It could lead to
Listen.
disability. Yes. So another thing is, okay, speaking of deafness, bomb blast. When there's bomb
Bomb
blast,
blast. Okay.
yes, that's another accident that could lead to deafness. When there's bomb blast within, it
The
could lead to a
environment.
baby losing the hearing organ. Okay.
Okay, thank you very much. Thank you. I really do appreciate. So my next question is there a difference between ADD and ADHD?
Okay, when you talk of ADD has to do with attention deficit disorder.
Okay.
You understand? Now, ADD was what was formerly used before ADHD is
ADHD, want me to,
introduced.
okay, okay.
Now, ADHD is attention deficit and hyperactivity disorder.
So what's
Are
now
you
the
saying the
difference?
difference is attention deficit? Inattention, the child is not able to focus
Focus.
on a particular task given to the child. Why hyperactivity? The child is unable to stay in a particular place. Do you understand? The child is always ahead, either ahead or restless. Do you get it? Yes, like I have a child like that. A one of my clients, I have the child. You cannot put the child to sit in a place to achieve a particular purpose at a particular time. It will take you a
A
lot
lot.
of things to do. Okay, do it this way. Sometimes you have to. It requires you pinning this child down. Do you understand? For you to be able to get the attention of that child. Okay, do you get it? So in a situation whereby you have to put that child down, the child is already hyper. That's different from inattention. Now, if, for instance, I'm talking to you and then you take your face away and you are still, but you are not paying attention
Attention
to
to
me,
you.
that's ADD. Do you understand? Attention deficit.
Okay,
Do you get
okay.
it? Now, if there is now restlessness attached to it, it becomes ADHD.
ADHD.
Do you get the difference? Now,
Mm.
ADD has to do with attention
Attention
deficit
deficit
disorder,
disorder.
while ADHD has to do with attention
Attention
deficit
deficit
and hyperactivity
hyperactivity
disorder.
disorder.
Do you get the difference?
Yeah, yeah, yeah. Thank you very much. Thank you for that. What are the common signs and symptoms of ADHD? What are the common child if a child is around the if a child is around there? So what are the signs that we're going to notice that this particular child has ADHD?
Okay, thank you very much. Um, a child with ADHD, once the child comes in, first, the child is, let's take for instance, the child comes into this place. You'll say the child wouldn't go straight to the chair to sit.
Okay.
Something will attract the child, something somewhere, and then you see the child moving to that thing that is attracting him or her, picking it up, trying to do one or two things with it. The child, you call the child attention, go sit there, and then the child is like, this is what I mean. This is where I want to go. The child is perambulating about. Do you understand?
Okay.
That way you know that, oh, okay, this child
Special
is a
child.
special child. Do you understand? So going to a child, so realize that this child is having attention deficit, you try to call the child, and then the child cannot look into your eye. Do you understand? Like the way you're looking at me now, a child with attention deficit will not be
Not
able to look
look
at me in
straight.
my eye except I call the child to my
Attention.
attention, either by shouting like, whoa, then the child will be like, what's happening? Do you understand? Or I snap my fingers at the child comes to me. You understand? Many other things we can do to call the child, the attention of the child to ourselves. You get it? So these are ways to actually know that, okay, this child has ADHD. Just saying that, okay, this child is not staying in a place, is not calm. Or, for instance, you have a child with ADHD in your class, and then you have the question,
I wanted to cite an
taking,
example like that,
okay,
but yeah.
you have the question and you were like, who can tell me this? And then you call the child. Let me take, for instance, I call Sandra. Sandra, answer the question. Before Sandra could give me the answer, and a child with hyperactivity would have already said the answer
Okay.
if he or she knows it. Depends
Okay.
on the age
Yeah,
or the
child.
stage the child is. You
Okay.
understand? Now, if the child could quickly say the answer, not waiting to take
Okay.
turns. Those
Hmm.
are some of the symptoms of ADHD. Do you get it?
Okay, a situation whereby because most times in our schools these days you see a teacher beating a child maybe because the child cannot be able to assimilate, or when they teach the child is able to forget one or two. So in this situation, what would be your advice? This forgetfulness, is it another symptoms of ADHD?
Okay, first of all, you don't beat a child that is not a special child, let alone a special child who doesn't really know his left from his right.
Okay.
Some of those kids, yes, we may assume they know what they are doing. Even if they know what they are doing, they actually we need to know that this is not a action they do deliberately. So if a child is, according to the regular setting, misbehaving, Instead of flogging this child, why not help the child? For instance, give an instance of a child who you are teaching, okay, and then all of a sudden the child just jumps up, something of such. Now, as a parent or a teacher, it is that's not the time to actually beat that child. That child reacted to something
Okay.
around or within. It could be the pressure. Maybe the child
Okay,
feels
that you need to
pressured.
know the cost of why the
You
child
need to
reacts.
know, why is this child misbehaving in this manner. Do you understand? If you don't, you may not be able to even tell. So that does not give you a right to beat that child. Beating the child will make it even worse. It's not even right for you to beat a child with
For a
special
child,
needs.
okay, for a special need.
Yes, it's not right for you to beat a child with special needs. You can correct them. Do you understand that? Okay, this will take me to then these children. There are some that are educable and some are trainable. Do you
Okay.
understand? When we get to the stages of ADHD, I'm going to explain this critically. But let's go back to beating of those children. Some of them, they don't really know what they are doing, or they tend to react based on the impulsive nature of them. Do you understand? For
Okay.
instance, if I'm sweating, like, don't you know I'm sweating and it's disturbing. You understand? So the only way I could react, I can't communicate to you because I'm having speech pathology, probably, or maybe I could talk, but I'm not ready to express
Let's
to
yeah.
you. I'm pressurized. Can somebody not see it? And then the next thing you're doing is to react in that manner. Do you understand? Okay, another way is for you to know that a child has ADHD. You see when the child hears a sound, some kind of sound, the
Yeah.
child is attracted to the sound, and then the child is going to the sound. Like, okay, I can hear the sound of, let's take a car, for instance. The sound, instead of the child is not conscious about the fact that, okay, this thing can actually hurt me if I go close to it. All I'm interested in is the sound. I'm attracted to the sound. I want to go see what it is, what kind of sound, why is it making that sound? They are just exceptional in that manner. So upon going there, it is you as a parent, a teacher, or caregiver to make sure to tell this child that it is actually dangerous for you to do what? For you
Need
to
to
go
go
there.
to
Do you understand? So they are attracted to sound. That's why they irrespective of how dangerous that thing is, like I think I
so that is
have,
one of the signs you know that
yes, you use to know
they're
that this
attracted
child
to
is,
sound.
yes, they're attracted to sound. And another thing that could make them feel disturbed, maybe a ringing in the ear. It's called tinnitus. Maybe the child is, I see some children, especially if they put their hands on their ears like this, and then they're like, I'm not in comfort. I don't like what I hear. They could be experiencing tinnitus in the ear. That's called ringing in the ear, and they just want it to stop. You understand? And you as a regular citizen, you'll be like, take your hands
Hands
off
off
your
your
ears,
ears.
sit down, do this, and all of that. You know, they're actually going through a lot,
Oh.
something they cannot actually express. That's why we need to be patient with them as
Mm.
caregivers to understand that, okay, what's the reason for this child? Rather than
Mm-hmm.
beating or shouting and screaming at them, there are times you need to do that. Not beating, but scolding them. There are times you need to do that to make them know that what you're doing is a bad behavior. Another technique I use sometimes is I make the child say it to me. This is bad.
Bad. Okay.
What do you have to say? What did I say? The child repeats, this
This
is
is
bad.
bad.
And then if I know that the child cannot talk or express himself, I'll keep saying it. This is bad. I'll call the child's name. What did I say? The child was, I'll say it on behalf of the child. This is bad.
Bad.
Okay? So that's how we attend to it.
Okay. Thank you very much. Also, please, if you are following us online, or you can drop your questions so we'll attend to them on the comment section. Thank you very much. So, is